Chair, RB, it gives me great pleasure to present the report of Welsh Council. I'm truly honoured to represent the medical profession in Wales, and this is a message directly to them. Over the last few months, we've witnessed the outstanding dedication of doctors in Wales, your exceptional contribution in caring for COVID-19 patients, while you and your families have grappled with a pandemic which has pushed you to your limits. You've experienced PPE shortages, exhaustion, deteriorating mental health, and yet your commitment to delivering world-class care for our patients has been astounding. For me, it was never in doubt, but you've shown what doctors are capable of, and I'm proud to represent you. BMA Cymru Wales has of course been supporting you every step of the way. Your safety, well-being and protection of your rights has been our priority. Using our COVID-19 tracker surveys, we've been able to lobby and campaign to raise your individual and collective concerns directly at the highest levels and find solutions to your problems as quickly as possible. Our presence on several groups planning NHS Wales' response to COVID-19, including the Welsh Government Workforce Planning Cell and weekly meetings with the Health Minister, has allowed us to push for change in several areas. As services transformed, we ensured that consultants and SAS doctors received favourable COVID-19 pay arrangements. In addition, we secured appropriate employment rights and benefits for Welsh medical students entering the workforce. We ensured that junior doctors would be paid for emergency rotas and for additional hours worked, as well as agreeing annual leave carryover between employers and across leave years. For GPs, we negotiated a relaxation of contractual add-ons and secured financial certainty for practices in relation to income sources such as enhanced services to let them focus on looking after patients during the crisis. Early on, we were unequivocal that doctors could not be expected to care for patients if they were putting themselves at risk. Our message was clear: guarantee adequate PPE or risk lives. Our demands were listened to, and Welsh Government substantially increased the production and distribution of PPE in the early days of the pandemic. Similarly, our calls for priority testing for healthcare workers and appropriate death in service benefits were actioned by the government. As one of the first organisations in Wales to highlight the disproportionate effect of COVID-19 on Black, Asian and minority ethnic doctors, we welcome the opportunity to feed into the group, which was subsequently set up to investigate it. We lobbied for an effective system of risk assessment for all doctors, including those from a BAME background, to ensure that doctors would be able to work in a way that minimised risk to themselves and to patients. I'm pleased to say that an All Wales risk tool was implemented, and we continue to feed in members' views to develop the tool further. But we know there are a multitude of complex factors explaining the disproportionate impact of COVID-19 on the BAME population, which can't be addressed with a risk assessment alone. BMA surveys have highlighted that doctors with BAME backgrounds can be less confident in raising concerns, more fearful of being blamed if something goes wrong, and are more likely to experience bullying or harassment in the workplace. Our series of surveys during this crisis have shown BAME doctors are more likely than white doctors to say that they feel pressured to see patients without adequate PPE. We simply cannot accept a culture which does not protect our colleagues. Welsh Government and health boards must facilitate real and genuine cultural change in the health service, and BMA Cymru Wales will be continuing to lobby for reform and to hold them to account. After all, we've seen what can be done. The Welsh NHS can be agile, it can be responsive to doctors' needs, and decisions can be made literally overnight. Improved video and mobile phone technology combined with new ways of remote working have transformed services, not only in IT, but in ITUs. Changes have been led and embraced by doctors. A reduction in paperwork, bureaucracy and unnecessary regulation has liberated doctors and allowed them to dedicate their time to seeing and treating patients. We've seen the potential of change for the Welsh NHS, and it would be a travesty now to go backwards. Systematic changes will be required to retain these positive improvements, like guaranteed access to up-to-date IT software and hardware, with a choice of systems and a degree of flexibility, the lack of which so far has frustrated healthcare workers for too long. These changes must be led by doctors and not by finance officers. Moving forward, BMA Cymru Wales will ensure that engagement between health service leaders and doctors is prioritised as services resume, and we look to achieve a coherent and long-term vision for the health service in Wales. And as services resume and winter pressures loom, I know that you will once more be readying yourselves to go above and beyond to care for patients and reduce the backlog in the system. So I want to remind you that we're here to look after you so that you can look after your patients. We will ensure that you're cared for on the front line, whether that's through our own 24-hour wellbeing services or campaigning to extend health board provision. Health boards have delivered in this area up to now, and we will make sure their support does not wane. We're also actively pursuing the provision of comprehensive occupational health support for doctors and staff in both primary and secondary care. It's been long promised but never delivered, and the gaps exposed by COVID-19 can no longer be ignored. We remain vigilant, hoping to avoid a second wave with the help and expertise of our public health colleagues, but rest assured that it will be our number one priority to ensure the changes we've secured during the pandemic will be extended if one arrives, just as we will continue to ensure that your views are listened to and respected as we navigate our way towards the new normal. Lastly, I'd like to thank Welsh Council for their support, and in particular our fantastic Welsh staff led by Rachel Podlack and ably assisted by Carla, Erica, Rodney, Gareth and their teams, and with particular thanks to Sarah Miller, our Council Secretary. RB, I move.